Our daily activities as youths are showering, running errands, socializing, getting dressed, and many more. These are all part of our everyday routine that for us is easy to do. However, those activities are a challenge for senior citizens as they have difficulties to complete those activities due to limited movement. What was mentioned earlier are simple challenges that they face. What about bigger issues such as health, psychological, financial, social, and physical? These issues are more challenging for senior citizens to survive in today's world, and that is what we are going to talk on in this video. The first main challenge for senior citizens is healthcare problems. The rising cost of healthcare within Malaysia will severely impact the treatment of senior citizens during the COVID-19 outbreak. Medical inflation is estimated to be at 15% each year, and health insurance premiums increased up to 30% in January 2020. Ironically, the reason why the cost of healthcare is steadily increasing is due to the increased advances in medical sciences and technology in Malaysia. The reason why this is a problem is because even though the rising cost mostly impacts the private sector, it also led to overcrowding of patients in the public sector, making treatment slower and less efficient. These problems surfaced at exactly the wrong time when the COVID-19 outbreak began in Malaysia. Not to mention that senior citizens are not only one of the most high-risk groups to suffer from the COVID-19
Suhu
virus.
populasi di Malaysia adalah paling tinggi bagi kumpulan umur 55 sehingga 59 tahun dan juga 60 sehingga 64 tahun.
They are also more often than not considered to be of low priority to government initiatives and treatments due to sentiments of ageism. What this means is that since the prevailing belief is that senior citizens will eventually die soon anyway, there is no point to prioritize their care over younger patients. They are also commonly at risk to a myriad of adverse diseases such as dementia, hypertension, and diabetes mellitus. This tends to leave them helpless as most of them constantly bedridden and relying on their children, grandchildren, and other relatives. All these problems only became exacerbated during MCO, since now they could rely on their relatives even less due to the infrequency of visits, not to mention the fact that the COVID-19 virus itself can be very fatal to the elderly. More than 50% of all COVID deaths were of age 80 and older. This is due to their weak immune system and other dysfunctions such as heart diseases, lung diseases, diabetes, and even kidney problems. Basically, during this outbreak of COVID-19, many elderlies are literally in a fight for their life.
So, in regards to my opinion about the healthcare problems that senior citizens face during the COVID-19 outbreak, is that I think, of course, I'm well aware that senior citizens are one of the most affected group. However, I think the problem that in regards to healthcare that people most often ignore, and by people I mean the common masses, is that the healthcare costs. Most of them are living off their pensions, and uh, they also nowadays find it very difficult to find a job. So all this led to them finding it hard to gain proper treatment during the COVID-19 outbreak. So yeah, I think healthcare costs is definitely an overlooked problem faced by senior citizens in COVID-19. And the best we could do is just to ease their burden by providing monetary aid.
Apart from healthcare problems, psychological problems among senior citizens should also be highlighted. Oftentimes, we refuse to accept that mental issues do not only happen towards younger people, but also senior citizens. One of the problems that the senior citizens face is loneliness. Senior citizens who live alone or with spouses tend to have fewer engagement and interaction with younger people. This can lead to loneliness because they have no one to share stories about their daily life. Furthermore, with the current pandemic situation, it gets harder for the children to visit their parents across countries. Also, the grief of losing their spouses, friends, or family members can increase the feeling of loneliness and sometimes it can be overwhelming for some people. This may lead to feelings of depression because it is difficult for them to overcome. Hence, it's important for senior citizens to always socialize and communicate with other people. This can be done if the children can contact their parents, often asking for their well-being. Loneliness can lead to depression. Loneliness can makes them overthink. That's why they easily feel depressed when they are home alone. Depression can affect the senior citizens in many aspects. It can lower their immune system and indirectly make them vulnerable to many diseases. Another factor of depression is the sentiment of ageism by various people. Ageism is prejudicial feelings against senior citizens by other people, leading to less than ideal treatment by healthcare personnel and even family members. This made treatment and welfare for them difficult since not many people are willing to tolerate their eccentricities. This can make the senior citizens feel worthless and useless that can bring psychological changes in them.
In regard to my opinions and observations of the challenges of the senior citizens that senior citizens faced is that we can't deny the fact that human will go through aging process. That's how life is, and it is completely normal because life is a progression from youth to old. However, aging is the time when we will experience a decline in ourselves in terms of performance, productivity, and health. Supposedly, the care of the senior citizens has always been the responsibility of the family to avoid such declines. But over the time, the senior citizens have been seen staying at home with no helpers or even no help from the children. Moreover, senior citizens who live alone will face social problems as well. They felt lonely because they have nobody to interact with. Their social life has been narrowed down because of the retirement and because of the death of their closed ones like spouse, family, and friends, which makes them feel the sense of loss. Also, their weak health that restricted them to participate in social activities can also be one of the factors. There are some children and relatives that left them in this poor condition because they feel senior citizens are a burden, especially those who economically depend on their children. So, social problems make senior citizens are likely to become socially isolated, which results in psychological problems such as depression and loneliness. With the implementation of movement control order, it increases their loneliness because they are not allowed to go out, nobody are allowed to visit them as well. So loneliness makes them overthink of their lives and their self. This leads them to easily feel depressed and it can lower their immune system.
The next challenge is financial issues. Many senior citizens do not have sufficient savings after their retirement. They live on fixed income which was inadequate to meet the current high cost living. This can affect their lifestyle as they could not afford the similar lifestyle they had before retiring. The reduction of income makes the senior citizens dependent on their kids and neighbors. However, during the MCO, the senior citizens can't rely on their children 100% as everyone is struggling with the bad economy. To financial issues, senior citizens had to find a job that can provide additional income to their living. However, not many employers were looking for senior citizens, as they are old and the salary will be high due to their experiences. Many employers want to hire young people because they are willing to get paid at lower rate. Also, the senior citizens are easily exposed to sickness and viruses. It got worse when cases of COVID-19 were detected in Malaysia. This will lower their chances to get a proper job and income to survive because they can't simply go out to work.
During this pandemic, an allocation of 25 million ringgit has been set aside by the government to help those affected by the pandemic. Of course, the senior citizens will also get a portion of it. However, in my opinion, what the government is doing right now is not enough. There are still many out there who still do not have enough to spend, or they do not have the means to spend it due to restrictions. The process to apply for the financial aids are very tedious, and these processes are not helpful enough for the senior citizens to apply for it. So many of them do not apply because it's too much. The process is too much for them. We are also too dependable on NGOs to help those in need, including the senior citizens, but they can only do so much. The government needs to provide a better solution, a long-lasting solution to help with the financial problems of the senior citizen during this pandemic because they are still a precious part of our society and they are not considered as rejects.
Not only that, senior citizens also faced social problems as the government has confirmed that the elders are among the community that will be much easier affected by the virus. The principle of closed door was automatically implemented until now, so they could not interact and engage with others. outsiders due to the rules that were implemented by the government. This scenario is due to their antibody that is much weaker than normal humans that will make them easily affected by the COVID-19. Therefore, it is important for them to not gather and meet with others because they can spread the virus easily. This situation gives a lot of pressure for them not only psychologically and physically, but also their relationship with society. It makes society feel scared to be around them. The closed door principle doesn't allow any visitation from their family members or anyone even for a short period. The major problem arises when certain family members insist on visiting their elders, as reported by the keeper of a welfare center. On the other hand, the homeless elders are among the group that have the highest risk to be affected by COVID-19 because obviously they don't have proper healthcare for a long time due to being homeless. Plus, they're living in a public area. It's a huge challenge for the government to arrange a strategy on how to deal with this problem. Huge challenge for the government to arrange strategy on how to deal with this problem.
I want to talk about the challenges faced by the elders during this period of COVID-19. Okay, first of all, as the government has declared that the elders has the highest risk to be affected by the virus COVID-19, the closed door principle was automatically implemented. Okay, so what is closed door principle? According to the government, the principle, this principle doesn't allow any elders to go out from their home, as well as it doesn't allow their family members, their sons, their children, their daughters, to visit them in their house, even they are living in the same district. Why? Because uh, they don't want if one of them are the carrier, it will affect easily on the elders. This is because, according to the Ministry of Health, uh, the elders has the highest risk because their antibody are much weaker compared to the youngsters, right? So, uh, by this problem, the elders not only are facing the challenges in terms of physically and in terms of mentally and healthcare, but it also affect their social relation with others.
Because of social problems, these senior citizens cannot do any outdoor physical activities. According to WHO, the increasing physical inactivity among elderly people is becoming a serious health concern. The benefit of quarantine is keeping people safe at home in order to avoid being affected by the virus of COVID-19. Especially the elderly people are the ones who are easier to be affected with the COVID-19. However, a health risk of being at home is a decline in physical activity, which has a negative impact on senior citizens. Besides, staying at home leads to a more sedentary lifestyle, such as sitting a lot or spending more time watching TV and engaging in unhealthy behaviors such as overeating, staying up late, and not getting adequate sleep, or even increasing tobacco and alcohol consumption. Moreover, reduced physical activity and unhealthy behaviors are linked to increased morbidity and mortality in senior citizens. The organization states that physical inactivity is currently the leading cause of death globally and is a contributing factor in the development of non-communicable diseases such as diabetes, cancer, and heart diseases.
The lockdown has resulted in elderly people by having very limited or no access to healthcare service since almost all outpatient clinics are closed because healthcare resources are mostly devoted to emergent care settings. Elderly people who frequently have chronic medical conditions find themselves worrying about their future and praying that nothing unexpected happens during the lockdown. However, the reality is that elderly people can safely participate in regular physical activity including aerobic exercise and yoga at their home. The important thing is for elderly people to be as physically active as they can, so simple activities can prevent chronic disease while increase mobility and make their life more enjoyable. They are in the period of physical decline, so as a result, they need to depend more on other people to continue their daily life and schedule.
Kementerian Kesihatan amat bimbang bahawa orang ramai mulai tidak memberi perhatian kepada kepentingan melindungi warga emas daripada jangkitan COVID-19.
In short, senior citizens are facing different challenges in their lives, and there are many of them, but we only mention a few significant challenges that they face daily during this pandemic situation. Now that we know several challenges faced by them daily, it is time for us to help ease and enhance their lives in order for them to be independent and to be better at taking care of themselves. This is without a doubt our greatest responsibility as members of the next generation. Thank you very much, and this is our project report on the daily challenges faced by the senior citizens during COVID-19. Assalamualaikum.